I'm Yvette Lien, an ER nurse here at Sidney Health Center and a charge nurse. I've been here for 28 years and have been in the ER for the last 16 years. It's very important. When it first started, I didn't think it was going to work. I didn't know that we'd have the staff, but it's very nice to have the flight here and available to get that patient to high level of care into the specialties as fast as we can. And then we don't have to wait that hour and a half for a flight to get to us. I'd say mostly medical. Probably our heart attacks are pretty high up there, or heart issues that they need to go see cardiology. We have a lot of fall that are traumas that need to be sent out that we can't surgically fix. The people that have multi-system issues that need the specialties that we don't have. So it's probably a fairly even number of all that. If the flight team's here, grounded, the weather's good, they can be here in 15 minutes and out with the patient. So that's a huge difference than waiting an hour and a half. So if you're waiting for a flight for an hour and a half to get here, that's an hour and a half another person is waiting out in the lobby if you're full that can't get back in. So the faster we can turn around the room that they're out of there, that we can bring another patient. And those tend to be usually the more critical patients. So it makes the ER flow go a little bit faster. I think mostly for us in the ER, the ones that we really are like so glad when the care flight is in town and able to take our flight is our trauma patients or our very critical medical patients having a stroke or a heart attack, to know that we can get them out of here faster. I think that's reassures the patient's family and the patient also, because they know they need that higher level of care to help them. And so it's a great feeling to know they're here and we're not going to have to wait another hour and a half. And it's only an hour and a half flight versus 3 hours. I think it gives them a little bit of peace of mind. I think also we finally made that transition, knowing that it's our care flight. This flight before us was very expensive and was hurting patients financially, and care flight, there's not that concern, so people are willing to take the flight, where before they were refusing it because of the cost. Our flight crew is one of the few flight crews that will fly site patients. As long as the site patient is willing and voluntary and cooperative and not dangerous, they will fly our patient to wherever. And those beds are hard to find, so we go to Wyoming quite a bit now, but Billings, Great Falls, Kalispell, because a lot of those people don't have the resources to get there. So if we finally find them the bed, they don't have the resource to get to that facility. So when we find them a bed and know that care flight will take them, I think that's huge. I think that's why it worked as a success, and that's why the cost can be improved, because we own the plane, the foundation bought it, and that's why they can take our mental health patients, and we can reassure the patients that after your insurance, then you know that the rest is done. Like, we can say that and know that we're not lying to our patients. We're very blessed to have this resource here. I was a nurse here for a long time without an airplane in Sidney, and it does affect our ability to fly people out. And so it's a good cause. Like, if you're giving money to the foundation to help support that service, you're helping not just you if you need an emergency, but a lot of other people that can use help.